Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to cover a case here that has a problem that you run into quite often, and that we have a situation. You have a TMJ problem. This lady worked for me, and she was there several years. She was having some difficulty with the temporomandibular joint up here. It was giving pain and everything, and what we needed to do was to bring her mandible forward. But if the teeth are interdigitated like that, you've got to take the upper teeth forward, and then the lower jaw can follow that forward, and that brings the condyle in a forward position and takes the pressure off of this retrodiscal tissue, which is highly vascular and does all these marvelous things. Lubricates the joint here, and it feeds the tissue in the disc, where the disc has no blood vessels and no nerve endings in it. It has to be taken care of. And this is marvelous how it works. Mine still work at my age. And this has been in there for, ever since I was born, it's amazing how it holds up. So if we go up and some way or another, the mandible wants to come forward, but it's being held back by the teeth, then we need to move the maxilla or the upper teeth forward a little bit. And then if we move this forward, then we can bring the mandibular teeth forward, and this pulls the condyle out away from the retrodiscal tissue, and the problem is over. That's where the problem is, though, is this pressure into this highly vascular tissue at the distal side of the condyle back here. So let's take a look here at how we move this forward in a rather unique way here. Here is a lady. She worked in the office for some time, and the maxilla, to get the jaw comfortable, we had to move her mandible forward. But then the teeth don't fit together, and when you turn loose, it goes back. If you wore a splint all your life and closed out here instead of here, you could get away with it. But she couldn't, of course, do that. And so we are going to show you what we did to advance the maxilla without pushing back. Normally a headgear, a reverse headgear, you put something on the chin, and then you put something on the forehead up here, and you push back on that while you pull the maxilla forward. But if you got the head of the condyle into this vascular area and it's sore already, you don't want to push back on it. It hurts, so it bothers people to do that. So we're going to try to advance the maxilla without pushing back on the mandible. That's the thing in a nutshell here. So here is what we used. We had to do some other orthodontic things, just touching it up. And this is a reverse headgear, and you've got little pads that come out here on the cheeks, and you have a strap that goes all the way around the head and holds this up on the forehead up here. And then you can come down here and pull on this, and it kind of rocks back and forth on the pad on your bone structure right underneath the eye of the cheek up here. Now I want to tell you, this tends to get the cheek sore, so you have to watch what you're doing with this. And then there are other ways of advancing the maxilla without pushing back, but this is one good way to do it. If you get somebody that's tough, when you put one of these up here, we're pushing in a distal manner up here, and it pulls this in a forward manner. It kind of rotates around this part like that. And so you put force on the maxilla and bring it forward. Anyway, we were able to bring this lady's teeth, the maxilla out, and then the mandible followed it almost without any appliance or anything. We did have them lined up and everything. And so here it is, and now we've got them out in that fashion, and this got her teeth fitting here. So these teeth are further toward the front of the mouth, and that allowed these to move out, and that allowed the condyle back here to get off of the retrodiscal tissue, and that's the thing in a nutshell, and that's what you want to learn how to do if you can do that. Now, here are some of the essential things on that. They bring the maxilla forward. There's several things. We'll mention them in other videos, like reducing the teeth between them and changing the space in between on the bottom and the top, and you can advance the contact of the lower in that fashion, like that. Let's see, there's other thing, allowing the advancing of the mandible forward. We got to get in there and do something to give it some room to come into, and condylar pressure is reduced when we take the maxilla forward. Then the teeth can fit together better in a forward position, and that's the thing that does the job for you. And you get rid of the discomfort and pain that the person has like that. And normally reverse head gears, if you see them, they push back on the chin and back on the forehead, and the force on the chin usually is about a fourth of what the force on the forehead is up here. Or take this back here, pull it right here, so there's more force on the chin than there is on the forehead up here, and so you're pushing the mandible back to get the upper teeth forward, and that's a hard thing to do if the retrodiscal tissue is real sore. You just can't do this. So we're trying to find something that will bring the maxilla forward without pushing any pressure on this. So thank you for watching, and I'm going to ease out of this, and I hope you'll continue with our group and subscribe to it. So we'll see you later.